Hi, I'm Dr. Johnny. Thanks for joining me today on Araji's quick clip on azelaic acid. Everything you need to know about it. Now, it does so many things, people wonder, is this possible? Today, I'm going to tell you what it is, what are the things that it can do, how to use it, and my take. Do you really need it? So we talk AHAs and BHAs, but azelaic acid is unto itself. It's actually produced by, don't freak out by this, but there's yeast on your skin and it produces azelaic acid. So it's all natural in that sense. It's naturally occurring on your skin today. But as a formulation in an acid, we can improve the amount or increase the amount that's on the skin for a more beneficial effect and to have therapeutic effects. So it is naturally occurring. The percentage that many people see is about 10% over the counter. Different countries are different. There are 15 to 20% products available. In the United States, over the counter, 10%. So what can it do for you? Many things. Number one, let's tackle acne. It helps fight acne. It can kill P. acnes, so the bacteria that leads to acne. And a lot of people do use it as a standalone ingredient, as a first-line ingredient, especially in pregnancy, because remember I said that it occurs naturally on the skin. So just boosting up the concentration a little bit because it's naturally occurring, we feel that this is one of the only safe products, or many products might be safe, but a lot of times we have to study them, and it's hard to study things in pregnant people. Either way, pregnant or not, it helps with acne. From the bacterial standpoint, a second hit is it's an anti-inflammatory. And a third one is it helps with pigment, because a lot of people with acne will have them in different stages, healing acne. And unfortunately, some people are left with scars from acne, whether they're pitted or whether it's discoloration in the form of a scar. It can help with that. I'll go into the discoloration a little more when we talk about hyperpigmentation. Suffice it to say, acne is one of the fortes of this product. It can work with retinols, just for those who are already on a retinoic, and I'll talk about that in the how to use them section. Number two, rosacea. Now, this is a huge topic. I have other videos on rosacea, but I mentioned it has an antibacterial effect and an anti-inflammatory effect, and both of those can be involved in rosacea. A lot of rosacea is not bacterial, it's more inflammatory, but we also, in accordance with having yeast on our face, we have natural bacteria. Sometimes they can overgrow, and there are many forms of rosacea, and some of them are pustular in nature. So, and again, of course, you can get hyperpigmentation. So this is effective for many with rosacea, and it's natural. And there's one other treatment that I mentioned that is natural in the form of light that works well with this, and that's IPL. I'm a very big fan of intense pulse light as well for rosacea. Number three, we'll go to hyperpigmentation because it's a big issue. And particularly melasma. Now, why is it that people like this product for melasma? Is because it targets the aberrant cells, or the cells that are turning over more than others, or aberrantly, if you want to think of it in that sense. What are those kinds of cells? Melasma, but also, unfortunately, not necessarily sunspots, but more towards cancer spots. So you have to be careful there, because it will make both better. You don't want to miss skin cancer. And so for many people, especially lighter skin types or family history or a lot of sun exposure, getting that skin check is important. But melasma is the one you're going to hear about, because melasma is very tough to treat. And it can be from hormones, it can be from sun and heat, and that's why we see it post-procedure. And it's one of the reasons I like fractionated RF treatments as opposed to more laser treatments that many clinics do, because radio frequency resurfacing and treatments, while they produce the heat, you don't get the light. So the light isn't targeting pigment with the radio frequency, it's just pan treating. In other words, it's treating by the electrical energy, not the light. So I can use it in all skin types, whereas the lasers, you're more focused on those in lighter skin if you're going to be aggressive. Melasma also occurs in people at the time of pregnancy. I mentioned it's hormonal. So azelaic acid would be one that one might consider using in pregnancy because of that reason. And of course, always consult with your physician before using it or doing anything in pregnancy, because people have differing opinions on this, but I'm planting that seed for you because some are contraindicated in pregnancy states, but melasma, very common. If someone's targeting sunspots or solar keratosis or uneven skin for other reasons, I would go more towards retinoids or AHAs, alpha hydroxy creams, than azelaics. Two other things worth mentioning: perioral dermatitis. That's a common problem, especially I see it in females. A lot of times people are on 4, 6, 8 weeks of antibiotics. Azelaic acid can work. Of course, there's bacterial component to that, so that makes sense. And lastly, but not least, is pore size. It can help diminish the size of pores in a very different mechanism than the AHAs and the BHAs. Finally, how do you use this great product? So this is a product you're going to use over time. It's not something that you're going to see the results typically in a week, 2 or 3, but it's a long hauler. So it's something that you want to use each day, maybe start every other day, and then you can work up with this product to using it each day, morning or evening, depending on your routine. I have a whole video on your layering skincare, but suffice it to say, it does create some irritation, especially initially. People do get used to that. A little bit of redness. Some people describe itching with it, especially as the concentration gets higher, or those with sensitive skin. So you can use a moisturizer after. For those who have oilier skin, tougher skin, they're not as sensitive, you can certainly use a retinoid with it, and you can stagger using potentially the azelaic in the morning and the retinoid in the evening. With sun exposure, everyone wants to know, the key with the sun exposure is, of course, if you're exposed to sun or light, we should always be wearing sunscreen, in my opinion. Skin cancer is a bad thing, and it's more and more common. However, it's more the irritation of the skin. So if the skin is irritated, red, crusting, itchy, sunscreen's most important, because that skin is more sensitive to the light's rays. And if you're on the programs that I like people to be on, which is alpha hydroxy, a retinol, a retinoid, and growth factors, people's skin is going to be more sensitive, because some of those products are helping remove that dead layer of skin on the surface. There's a fresh, glowing layer beneath, and sunscreen's more important in that situation. So morning or evening, but many people use it in the morning because they're using their retinols in the evening. You know, I love growth factors. This does not interact or interfere with growth factors. And do you need the prescription strength? No. Most people do fine with the 10%. More is not better. And remember, with that sensitivity, people do get used to it. So if you were applying it twice a day, if you needed more of a dose, or you needed more of an effect and you're tolerating it, you can use it morning and evening. It plays well with other products, because remember, it's something naturally occurring on your skin already. One of my favorites is Paula's Choice Azelaic Acid Booster. It also has licorice root and salicylics. Of course, salicylics help with acne, diminish blemishes, and help with pores. A great choice if you want a bit of a combination. And Glytone Enhanced Brightening Complex. Now this also has a glycolic acid in it. Many of you like glycolics, and it's a great synergistic blend. Both will last you a long time, and I think are well tolerated, good products that my patients enjoy great results from. Let me know your favorite azelaic acid creams. I put a complete playlist up here on things you can do at home, and one down here on layering skincare, so you can keep your skin and body beautiful, healthy, and vibrant.